research fellow, and today I will be presenting Living Post-COVID-19 Pandemic, which will mostly focus on the rethinking of spaces and energy use in house. I'd like to take this opportunity to just say thank you to the organizers. It's an incredible, relevant workshop that will help to promote collaboration across researchers and institutions. So just a brief introduction. So about my experience in the built environment, I have an interdisciplinary background. I hold qualification in architecture and urbanism, and I have a master in civil engineering with a PhD in architecture. So this puts my expertise sitting between architecture and engineering. I also have practical experience in industry. My focus is thermal comfort and energy efficiency in buildings, and I'm a certified passive house designer, so I have interest in cities and communities, such as research in temporary urbanism, in reuse of spaces, community energy, and at building level at fabric first approach and social and affordable housing. So I have this intercultural approach. I have experience in a global south country, also in a developed country. So in research, this is very relevant because we need to keep in mind when we are developing a collaborative research project that we need to explore these differences and consider each context individually and in comparison as well. So said that, I'd like to talk the key aspects that I'm going to present today. I will talk about the impact of COVID-19 in the built environment, but much more in terms of the living spaces and the electrical energy use. And I will briefly touch some aspects on the cities. We focus on use and reuse of these spaces. So this is all supported by my research, and these publications that are in your screen now, they are the basis and help shape this argument. So, and here are the references in case you want to look into more detail. So the topic here is not to show my research itself, but the potential aspects for future collaboration and things that can be addressed and further developed. So the first one is more like a study that I did years ago. It's part of my thesis about spaces and how big are the spaces in Brazilian buildings and in comparison with other parts in other countries. So the middle one is a more recent research that is part of a big research project that is funded by ERA in the past and Innovate UK now, that is part of Active Building Center research, and talk about energy consumption during the lockdown. And the third one is an interdisciplinary project that was conducted years ago, funded by FAPESP, that is São Paulo Research is a research institution that in São Paulo, and University of Nottingham, University of Birmingham was with researchers from University of São Paulo, Brazil, Nottingham, and University of Birmingham. That is really interesting about how to use, how to make temporary uses of the city, how to activate spaces that were not, were a bit run down. So it's very appropriate in times of COVID. So if we look to the COVID-19 pandemic in 2020, it prompted a series of challenges within the built environment. Everybody knows that. So lockdowns and restrictions limiting people's, is everybody hearing me?
I can hear you. Yeah.
Okay.
We can hear you. By the way, can you use the full screen? That maybe it's better. Full screen. Now it's not full screen.
It's not full screen.
Yes.
Oh.
Yeah. Now it's okay. You can. Yeah. Click here. Yes.
Yeah.
Yes.
Sorry
about
that.
Now it's better.
And I forgot to turn on my camera as well. So.
No problem.
I was talking about the COVID pandemic in 2020. So it was limited people movement, and it mostly changed the way that occupants inhabit their own living spaces and consume energy. So I'd like to introduce first these aspects on the living space, on the houses. So in the UK mostly, the data suggests that prices has increased steeply in 2020. As you can see here, you can see that in 2020 they were much higher than the other in comparison to the other years, and people now are looking for bigger homes. So the idea of more flexible spaces that can accommodate more functions as we now increase our time indoors, using it an environment to live, eat, socialize, work, pretty much everything. So it's very important to say that it's still very early stages to tell how it's going to be this in the future, and if the pandemic is going to have lasting impact on the city and in the housing market prices. So also in terms of the living spaces, there is a need, and I think other presenters said that, especially Ali. I think he mentioned something. So I need to provide a healthy living environment and living conditions with minimal housing standards and flexible, and if not larger houses, flexible spaces that can give appropriate conditions for the lifestyle that we have, and that can accommodate changes in use. And this was essential before the pandemic, and I think it's aggravated by the COVID pandemic. So it's essential that we can look into this. So if we look at spaces in central area near to the service, of course, our house is going to be smaller, it's going to be limited in size, but it can be flexible. It can offer a range of layouts and a range of functions that can help us to develop our activity. So here you can see an example of a flat that is 28 square meters, but use adaptable and foldable furniture. You can overlap uses such as sleeping, dining, working, just by folding and moving this. And this is fundamental if we're talking about smaller spaces. So there is also a contradiction that we need to look into that across the countries. So some countries in the past set minimal housing standards for living, and these countries are now building much bigger houses. If you compare Denmark, that is the second one, or Luxembourg, that is the first one in the graph, with UK, for example, they are building much bigger houses in comparison to UK. So this is essential, but we also need to look in across the same country. For example, in Brazil, is global south country, we have, for example, is building similar to UK in terms of size. But if we look at different income, different like low income classes here, you can see that social housing in Brazil, for example, that is very compartmentalized typology with little flexibility in the typology, and many people live in this house. Sometimes there is a cohabitation in this space. So it's just 36 square meters. And if you look at London, London recommendation, this kind of typology would be essential to have at least 60 or 70 square meters for a family to live there, 4 people, 2 bedroom. So this is really needs to take into consideration to help inform designers and the sector in general. So the pandemic changed the way that we occupy our houses, but what exactly has changed in our lifestyle to impact in our way that we inhabit it and in our energy use? So prior to pandemic, our patterns of employment were different. We had more time away from home. Our commuting, longer working hours in result for late homecoming times and reduced time spent indoors. Our socialized was outdoors as well. So during the pandemic, we have a prolonged occupancy, working from home, meals consumed and prepared at home most of the time. We have the commuting reduced or completely excluded if you are not a key worker. And so we use that space to live at all times there. So here is actually the result of a study that a paper that we just finished is going to be published in a few weeks in an international conference on sustainable and energy buildings, SAB 2021 in September now. We quantify the impact of electricity use during the COVID, looking at 22 different houses which are part of community energy scheme in Nottingham. So it's Trent Basin. Not sure if people in Nottingham knows about this development. So Trent Basin is developing a smart local community energy system that manages renewable energy generation, storage and utilization in order to maximize renewable energy deployment and alleviate grid constraints. So likely to occur due to the increase of electrification of heating through heat pumps and transport like EVs. So in order to optimize the local energy system, it's essential that we understand this data, critical scenarios, and we can be like adaptable and resilient in case events like this, like a global pandemic or other events can happen. So our data actually shows that working from home changed dramatically and impact the time of use. And here we have a graph of a single property that more or less illustrate what we have. So we have the morning peak is now shown to be later in the day. Evening peak is now earlier and longer than before, and energy use at lunchtime is now becoming more significant because we added now the meal preparation at our baseline. So and the results also demonstrate that compared 2019, 2020 to 2020, 2021, focus on the period of restrictions, like is from March to 2020, from February 2021 in comparison to the prior year. We had 17% more consumption in the year of restrictions. So this is really essential. And here I'm just talking about electricity. I'm not talking about heating, that in this case is provided by gas. Okay, so I'm just finalizing. So pandemic really it makes us to think how about the climate emergency. We need to look at decarbonization agenda versus retrofit, especially when we need to consider the heating in this equation. We could see through this study that is going to be published like in a few weeks that is actually electricity point of view, this is very significant, and if we put heating in this equation, it's going to be much higher. So in Nottingham, if we look in Nottingham, the potential to actually retrofit Nottingham is very big. We have a huge number of buildings that are EPC D and or lower, would be around over 70,000 households if you consider just houses. That could have an impact of over 173,000 inhabitants of Nottingham. So it's a huge number. And if you look just in the city, imagine if you look across the country and goes on. So my last slide is just to say the pandemic imposed new reuses of the public spaces and the buildings. And here we can see that temporary reuses as a response for specific needs. So we don't have to have that function anymore. We need to have a temporary function in between. So is a reuse of the space in between solution. In this case, we had in London hotels for homeless people during at certain point of the pandemic. We have arena here being considered as a vaccination center. We have the parking spaces.
Excuse me, Dr.
Yes.
Tubelo, can you speed up your presentation? Thank you.
Yes,
so,
the last one.
Yeah, a little too long. Okay, thank you.
The parking being used as a waiting area, and the same for the stores. So that's all from me. Thank you.
Okay, thank you, Dr. Tubelo. Very nice presentation. Okay, thank you. Okay, so now can I invite all the speakers to open your video and your voice? So we have about 10 minutes to discuss. Okay, any question are welcome to any speakers.
think we have several questions from the meeting chat.
Yes. Okay.
Yeah, I think
Please.
there are several questions. The first one is from Murtaza. He's asking the question about I think it's Pretty Paris. It's the question is what factors will promote higher provide investment in these social projects? Yeah, along with equality for the impact people. So yes, could you talk
Thank you,
about
Murtaza. That's a very good question. And if I had more time, I would have covered it in the presentation itself. I think for the private sector, it is important to invest in improving living conditions in cities, because say if you're running a factory or industry, a lot of your workers will be living in deprived conditions. And if your workers are living in deprived conditions, it means that they will have high medical expenses, they will suffer from poor health, and that will reduce the productivity. So there is this enlightened self-interest for the private sector to invest in good infrastructure for its citizens, for its workers in the cities that they live in a way. And this was seen in one of the projects, slum projects I worked in India, where a private sector, a company manufacturing denim jeans, invested in a slum project. And the amount of money they invested to contribute to the infrastructure costs was 1/10 of their advertising budget. But the amount of PR and goodwill they got out of that and from the work-based living in the settlement was tremendous. And then they decided to continue their intervention there to look at improvement of skills. So they started training residents on things like, for example, driving cars or other skill sets to improve their living conditions. And they formed this long-term kind of bond and relation with the community. So for the private sector, if there is a strong business case, which includes the social and environmental and economic dimension, yes, I think they would be interested in investing in good infrastructure. And I know there's sometimes caution that if the private sector invests, the only motivation is profit, but we are finding that it depends on who the private sector is and what their value and mission is. So I don't know, Murtaza, if that kind of
no, thank you. Yes, that was an interesting point of view, and I agree with whatever you said. So in fact, after this meeting, if you are keen, I would like to send you a case of Bhiwandi in Maharashtra, where the entire manufacturing, the fabric industry, the handloom industries, the power looms, they have all their workers are from slums, but somehow they are very nonchalant towards their upbringing or towards the condition. So it would be an interesting case to see if somehow external institutes like your own UCL or your think tank could somehow influence those bodies to move in a positive direction and bring about a change. If that is part of your research, to engage with local communities and business proponents to see if something can be done in those areas, then I would love to take this conversation ahead in private.
Absolutely. Please share this. Please share the information with me, and I'd love to have a discussion with you, because this is precisely what our center and academics fight for, is to convince people to invest in infrastructure and engineering solutions to improve living conditions.
Okay, thank you very much. So the next question is also from Murtaza. Thank you for your question. So I think this is the question for Dr. Huang Jianxiang, right? So the question is the use of tracer gas for validating airflow a close proximate for a virus flow? And the second one is which turbulence closure model was used in the urban air software? Yeah.
Oh, thanks for the question. The first one I think is straightforward. I think we have a good faith in the airborne virus. These particles actually, according to WHO definition, it's actually under 5 microns, very small particles. These are well, residuals, saliva is dried up. They have small things suspended in the air that can travel with airflow. So we use very ultrafine particles. I think we use I think the PM1 and PM5. I think so as a proxy to simulate those particles and the behaviors and this dispersion in the flow field. Okay, I hope that satisfied your question. The second is asking about the turbulence model. I don't remember exactly because one of the collaborators, Dr. Shanshan Ho, actually from Cardiff University in the UK, I think she did the CFD. I don't think it's KE, but I think it's a fairly simple CFD model. So I'd be happy actually to shoot a question for her. I think for the answer. I think we have the details. I think in the appendices. But and for your other inquiries, be happy to follow up. If I can send you more details. If you're working on similar domains, I think be great to connect in future. Thanks again.
Thank you so much, Dr. Huang.
Okay, thank you very much. So, is there anyone have questions? Please raise your hand. Okay, this is a question from John Closet. How does the pandemic affect the power imbalance? This is the question for Dr. Hu Mao.
Hi, John.
Yes.
Thanks for the question. And actually, I think somebody had mentioned that the pandemic actually has a large radiation for the power imbalance issue. Actually, that is the benefits. And we can see, because like most of the people stay at home, and there is a rise for the residential buildings, and it is a relief actually for the commercial buildings. And for the power imbalance issue, actually this is actually it depends on which region you're going to look at, because for some regions, if that is the substation is in the residential region, the power imbalance issue may getting worse. But if that's the region is a commercial region, that may, there is no such a power imbalance issue. So it's largely depends on what kind of the region we are considering. Yes.
Thank you.
Okay, thank you very much. Is there any other questions? Sorry, Professor Han, did you post a question? Is it for Dr. Huang Jianxiang as well? Because Professor Han said he's interested on the comparison of infection risks between indoor and outdoor. So
Yes.
maybe, yeah. Do you want to talk about this?
Oh yeah, that's a great question. We have those illustrations and other statistics about the power statistic model, how the outdoor indoor transmission route can explain the disease patterns. I think statistically, I think we did find the outdoor route actually slightly performed better based on the 2005 Professor Hugo Lee's original study published in the Indoor Air of the multi-zone indoor air transmission model. So I think that actually it raises this sort of the question that this is a transmission risk previously downplayed by the public health interventions. I mean, now the messages we have is quarantine at home, but if you do that in high density cities such as Hong Kong or elsewhere, presumably we don't wear masks indoors. And then if they're super spreaders, I think that's going to be added risk factors. And the longer you stay at home, the more likely you're going to breathe in some viral particles that's still capable, viable to causing secondary infections. So this is sort of the I think we put in additional materials in the supplementary the document, so the link actually click on the this paper, you'll be able to see that statistical the comparison between the outdoor and indoor. I hope that answered your question. I know the traditional literature really think that the indoor transmission model is the mainstream, but I think we're raising a little bit a tricky question, the possibility that the outdoor cannot be ruled out, at least from our evidence.
Okay, thank you so much, Dr. Huang. Yeah, so outdoor is relatively safe, but maybe it's not absolutely safe. Yeah. Yes. Okay. Thank you.
Thank you very much for your answer. I think there are still some questions in the chat, but we are running out of the time. So maybe you can just type the answer in the chat, and we need to move on to the next session. Thank you for coming to this session, and thanks for all the speakers.
Thank you.